ETOIMS, which stands for Electrical Twitch-Obtaining Intramuscular Stimulation, is the only non-invasive treatment directed to stimulate the neuromuscular junction in order to relieve pain. It uses an anatomical and physiological approach to treat muscle pain and discomfort at its immediate source with very brief electrical stimulation of neuromuscular junctions, also called trigger points, to elicit characteristic twitches.
Dr. Chu discovered that patients found pain relief with the EMG pins.
So I said, since I got the results with the EMG pin, why don't I use the EMG pin electrode to treat people?
Dr. Chu's method looks similar to acupuncture. However, in acupuncture, wire-like needles are tapped on energy systems to restore the flow circulating through the body. But here, Dr. Chu applies the EMG pins directly to the muscle.
What I do is that I just go around feeling on the patient's muscles where there might be a bend or a note or a rope-like feeling, and then I will put the pin in. Now, while I was doing this treatment, I found that if I go into certain areas in the muscles, that the muscle would jump like a frog. The twitch is important because when the muscle twitches, it means that I have broken the spasm. And the effect of the twitch is exercising the muscle within the muscle. Only if people's muscles can be twitched, that's when I can help.
It is that muscle twitching that gives the massage-like effect and relieves the pain.
I knew from then on that I should do this treatment by getting the twitch to come out. So I call this method the twitch-obtaining intramuscular stimulation.
Dr. Chu had been practicing this procedure manually for years, but recently she came up with the idea to automatically insert the pins.
The gun would push the needle holder in and out into the muscle 3 times, just 3 times, and it will be done in 2 seconds. I cannot help people who have pain because of a gunshot wound or a knife trauma or a fracture pain. This pain is for nerve-related pain, so this would be any patient who have irritated nerves, and they would have neck pain, back pain, hip pain, leg pain, arm pain. Wherever there is muscle spasm, I would reverse the muscle spasm by causing the muscle to twitch. Needle Etoims was initially performed using manual insertion with electricity for twitching provided by the EMG machine. Then I made a device to automatically insert and retract the monopolar needle electrode with electricity applied to get a single twitch.
Dr. Jennifer Chu is a rehabilitation medicine specialist at the University of Pennsylvania Medical Center. Her approach is a unique marriage of acupuncture and electrostimulation.
It is East meeting West. Acupuncture works at the point of penetration of the needle into the muscle, and if the needle can get into the nerve and muscle meeting point, then you excite the nerve so that the muscle can contract and relax.
It's called electrical twitch-obtaining intramuscular stimulation, ETOIMS for short. Dr. Chu has designed an electrode that pulses a needle into the space between the affected muscle and nerve. A wave of electricity from the needle's tip does the work.
This muscle jumping is the necessity relief that you need for breaking pain.
For over 30 years, Dr. Jennifer Chu, Associate Professor in Physical Medicine Rehabilitation at the University of Pennsylvania, dedicated herself to finding a solution to the management of myofascial pain and fibromyalgia. For almost 2 decades of research, the present method, Etoims Twitch Relief Method, became state-of-art and non-invasive. Many patients treated with Etoims Twitch Relief Method enjoy increased quality of life, and this is precisely what we hope for you.